Hello and welcome to WTNB Today. I'm your host, Wendy Benton. I have back today James Gose. He is the physical therapist and director of Star Physical Therapy Clinic in Ottawa. Welcome back, James.
Thank you, Wendy. It's great to be here.
Well, I'm glad to have you back. Last week when you were on the show, we talked about back and neck pain excuse me, being the #1 complaint of patients, and you actually went into the description and causes and issues with bulging discs, and we really did not, there's so much to cover, we did not even get to the degenerative back disorders or degenerative disc disease. And you're going to talk a little bit about that today, as well as neck pain, and see how far we get into that discussion and maybe have you back about some other ailments.
Sounds good.
Tell us a little bit about the bulging disc, just to review from the last show, what causes some of that back pain.
Be happy to. Yeah, the bulging disc, there's a lot of different words, a lot of different terms for a bulging disc. Some people say herniated disc. We even abbreviate that HNP, herniated nucleus pulposus. The nucleus is the inside jelly-like soft part of the disc, and that can bulge out the back. So sometimes we'll hear a slipped disc. There's no such thing as a slipped disc. It's the disc that will bulge. But to review how a bulging disc typically occurs, we tend to forward bend in life too much. Some studies say humans spend up to 80% of their lives in some form of forward bent position. We often sit slouched, which is a forward bent position of the spine. And we do a lot of forward bending over the sinks when we do yard work. And unfortunately, although most people have heard bend your knees and keep your back straight, most people don't do that. You see lots of people working in jobs like nursing or hardware, you name it. Everyone is bending forward at their waist. And when we do that, the vertebrae compress the disc, which is like a jelly donut. When the vertebrae compress the front of the disc, the gel in the middle is pushed toward the back, and eventually that can weaken the back wall of the disc, causing it to bulge. Bulging can push into innervated ligaments, causing back pain. If it pushes out enough, it can hit the nerve root, and then you get buttock and leg pain.
And that is typically a problem, you said, between the ages of 20 and 50, is that correct?
Peak ages, you have to be old enough for the forward bending to catch up to you, so as young as 20, 25, but the peak age is around 40.
Okay.
By the time we get to 55, 60, the nucleus pulposus, the hydration in the disc, begins to dry up, and then the incidence of disc bulging goes down, and we move into our next topic, degenerative disc problems, from the disc breaking down and getting dehydrated.
Yes. Well, let's talk about that. I had mentioned, I've got family members, an aunt and my mother-in-law, they've got arthritis in their back as well, and you had talked about the degenerative disc disease. So explain that, and I would love to know some things that they could do to help that.
Yeah, it's very common. More than half of my patients have what we would generally call degenerative disc disease. And it's a funny term. It's not really a disease, it's a disorder. It's for the most part a normal part of aging. But here's what happens. As we age, when we get to be around 55, 60, the hydration in the disc begins to dry up. The nucleus, the soft center, becomes less hydrated, and the height of the disc will eventually shorten. So the vertebrae will come closer together if the disc height gets smaller. So the disc begins to break down, gets more thin. When the disc thins and the vertebrae settle closer together, there are two joints here in the back where each vertebrae come together. We call these facet joints. When we're young, 25, 30, we have nice hyaline cartilage that makes these joints smooth. But when the vertebrae settle closer together, they compress more, and that cartilage begins to break down. When the cartilage breaks down, we eventually get to, like with a degenerative knee, where these joints are bone on bone. Whenever you have increased joint compression, the body tries to build up the structure by adding bone, and we get bone spurs. So the joints break down, and so that's the form of arthritis you're talking about. There's a lot of different terms for this. facet joint arthropathy is one word. That means you have arthritis in these facet joints. Now, when these joints compress harder, you begin to get back pain. But as the vertebrae settle closer together, you see the hole for the nerve root right here is formed by a top vertebrae and a bottom vertebrae. When the vertebrae settle closer together because of decreased disc height and because of bone spurring that occurs off of the facet joint, you can lose space for this nerve root. And then the nerve can get compressed due to flattening and degeneration of the disc, causing leg pain.
Okay. Is there a solution, especially for older individuals that have this problem, that might be more sedentary in their ways and, not exercising? What can they do to help alleviate some of that?
Yeah, there's some really good programs that help out a lot. Typically, the symptom description for degenerative disc disease is where they have increased back pain and leg pain when they stand and walk. So when we stand and walk, our back tends to arch, which is backward bending. And when the back arches when we're on our feet, it compresses the joints harder. So you get back pain, and then it compresses the nerve and you can get leg pain. The way we address this is purely through mechanics. When we forward bend the spine, the facet joints decompress. They open up, and the space for the nerve root opens up. So we treat degenerative disc disease with what we call a flexion-based exercise routine, where we do exercises that encourage like knees to chest to open up the vertebrae, even what I call the airplane crash stretch. If a plane's going down, the pilot says, grab your ankles. So we do a lot of flexion of the back in sitting to bend forward, because again, that opens and decompresses the facet joints. It stretches any overlying tight tissue like scarred down ligaments or tight muscles to allow us to buy a little room in here to take pressure off the facet joints and to decompress the nerve root. So if standing and walking makes it worse, sitting and forward bending stretches makes it feel better. So that's stretching to decompress the structures to alleviate the pain. And in this case, we actually do some abdominal muscle strength training. The abdominal muscles sit right here. If the abdominal muscles are good and strong, we can keep our backs from falling into too much arch when we're standing and walking, and maintain the spine in a bit more of a neutral position by training the abdominals to be good and strong. So through muscle strengthening and stretching, we can alleviate a lot of the pain. But the fact of the matter is, with degenerative disc disease, we can't rebuild the disc. We can't take away the bone spurs, but we can educate and teach the patient to manage it and alleviate some of their symptoms. And we have plenty of folks who come into the clinic that are 70 years of age. They've had back pain for 6 months and maybe leg pain as well. And usually within 6 to 9 treatments, they can alleviate most of their treatments. And a lot of our seniors want to be active walking, and walking is the very activity that aggravates degenerative disc disease. So oftentimes we can get them back to their walking program.
And is this, there's similar exercises, for instance, like if you have it up higher in the neck area or shoulders, and I'm talking about the arthritis in those areas.
Yeah, I'm glad you asked, because it's interesting that we're on the topic of degenerative disc disease for the lumbar spine. Wendy's asking about neck issues. The neck disc are different from the lumbar disc. I had mentioned the lumbar disc is like a jelly donut with a soft center. The disc in the neck are smaller, and they don't really have a gel-like center. They're more of a solid type structure. We talk about the consistency of like a bar of soap. The disc in the neck can deform, especially when we're younger. And when I say younger, like we begin to see some bulging disc in the neck, late teens, mid-20s, early 30s, and mid-30s. But by late 30s, early 40s, the disc in the neck begin to dry up and degenerate. As I mentioned, what happens to the lumbar disc by 60, this begins to happen with the disc in the neck by late 30s, early 40s. So the incidence of bulging disc in the neck drops off dramatically after the age of 40. So we begin to have to treat neck disorders beyond the age of 40, 45, exactly as I described in the lumbar spine, where we may flex to open up the facet joints and take pressure off the disc. But if you're still maybe 25, 30, the disc can deform and bulge, and we have exercises that will reduce a bulging disc and clear arm pain, but you have to be with a properly trained spine therapist who knows how to properly test. I mentioned last time doing repeated motion tests. Bulging disc in the neck and degenerative disc in the neck behave completely opposite of each other in terms of testing and symptom production. If you know how to discern whether it's a bulging disc or a flattened degenerative disc that's causing the symptoms, you can target the mechanics and do corrective exercises. But it's important to know what you're dealing with, because if not, if you move people in the wrong direction, you can actually aggravate their pain and make them worse.
Okay. Now, would that feel like muscle pain as well? Say it's the degenerative, the arthritis, would that kind of travel to the shoulder area, or, you know, out to the arms?
Yeah, that's a great question, because I have patients who come to me with a diagnosis of upper trapezius strain, this muscle here, but they've had no incident of trauma or physical activity where they could have sprained a muscle. They just woke with pain. So a lot of times that is either a disc, a bulging disc, or a flattened degenerative disc, but both a bulging disc and a flattened degenerative disc can produce pain in the upper trapezius area, in this area here, the mid-scapular area. They can refer pain into those muscles, but it's not usually a muscle problem. It's referred pain from the joint or the disc area. So again, centrally the problem is here, but you can get pain in the upper trapezius, between the shoulder blades, even into the upper arm, just from the joint arthritis. And if a disc bulge hits a nerve root, or if the disc is so flat that the vertebrae settle together and compress the nerve root, you can get pain, numbness, tingling, weakness in the distribution of that nerve root, and each level has a different distribution. So again, it's important to determine which is causing which.
And I'm sure that feels like symptoms of a heart attack often. I know my aunt experienced that in her arm and was fearful that it was her heart.
Right.
And it ended up being the arthritis in her back.
Yeah, it's interesting that while these nerve roots have certain patterns of symptom distribution, they can refer pain into the chest, as you just mentioned. It's not unusual, and even as far down as the bottom of your shoulder blades. So a lot of times individuals will think they've strained a muscle between the shoulder blades, but it's coming from here.
So coming in to be have an assessment and just your movement, like you said, just to determine where exactly their pain is coming from, then you would put them on a course of exercises, and they would come in to you for several treatments, and then like we mentioned in the first show, after that, once they've gotten those down and that pain is eliminated, they can work on those things themselves.
Yeah, after a good thorough assessment, we ask a lot of clearing questions to make sure there's not anything else going on, but as I mentioned last time, we want to determine what the incriminant structure is that's producing the pain, be it joint, disc, muscle, and then target the treatment toward correction. The wrong approach is to treat all necks and all backs the same and do what I call a multi-directional exercise program. If a practitioner is giving you exercises in 6 different directions of movement, they likely don't know what structure is causing the pain. In the case of the approach that I do, if it's a bulging disc or a degenerative disc, there's usually 1 or 2 directions of movement that we do to influence the mechanics of what's making the person hurt. So we teach exercises to relieve the pain, and then we do a lot of hands-on manual therapy as well to further the amount of mechanical force that we can put on the spine to change what's going on that's producing the pain.
Okay. Well, it's so interesting to me, and we want to make sure that if any of our audience does have issues with back or neck pain or any other hip pain, knees, any of those things, that they give you a call and go see you. And tell them where you're located again in Ottawa.
Yeah, Star Physical Therapy. We're on Little Debbie Parkway, just past Walmart, if you know where Walmart is in Ottawa. And we're happy to answer questions over the phone, and we also will do a free assessment if someone just wants to come in and speak with a physical therapist about their problem for 15 to 20 minutes to see if it's something we can help them with, we're happy to do that for free. So.
Okay. Well, James, you're going to have to come back. We've got so many things to talk about. And I know that, like with my family, we've had hip replacements and knee replacements. So I would love to talk about those as well. Not replacements, but just things you can do to kind of stay fit and healthy. And we want to invite you back again and do another show. If you've got questions for James, and please visit our Facebook page, and you can post your questions there, and hopefully we can get some of those answered, and we'll just have you back. I love this. I love talking about these things. I think because I'm going through some back pain right now and want to get that fixed. So thank you for being here.
It's my pleasure, Wendy.
Thank you for joining us, and we will see you next time on WTNB Today.